All right, I'd like to welcome everyone to the January 21st, 2021 regular meeting of the Marysville Board of Education. Call it to order and ask for a roll call, please.
Mr. Luke? I don't think he's signed in yet.
He is on his way.
There he is. Okay, Mr. Luke is present. Ms. Savage?
Here.
Ms. Powers?
Here.
Mr. Smith?
Here.
Ms. Devine?
Here. And now if you'll stand and join me in the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
First up on our agenda tonight, I would accept a motion to adopt this agenda.
So moved.
Motion by Ms. Powers,
Second.
second by Ms. Savage. Roll call.
Ms. Powers?
Yes.
Ms. Savage?
Yes.
Mr. Luke?
Yes.
Mr. Smith?
Yes.
Ms. Devine?
Yes, motion carries. And tonight, we need to thank again Jason Orsina from the our Union County Health Commissioner is joining us to give us another COVID update. So thank you so much for being here with us again. We really appreciate it.
Yeah, happy to attend. Biggest news, obviously, since the last time we spoke, is the addition of vaccination within the county. I'll speak just briefly to it, a little bit towards vaccination relative to what it means for the school district, and a little bit about disease expectations right now within the community. So if you follow the disease monitoring tracking the state does, what you've probably noticed is what I call a lot of volatility within a narrow band within our case rates and ED experiences, et cetera. What we've been seeing through the holidays was we generally stayed at the same transmission rate, same ED visit rates, more or less averaged over time, but we saw a lot of volatility day to day, week to week. Some of that was accounted for. What appeared to be going on is folks were delaying going to doctor, going to the ED around the holidays. That's speculation, but that seems to correspond with what we're getting in terms of the data. We've seen a decrease in testing, which is somewhat concerning because the decrease in testing has also been coincided with an increase in positivity rate. So the fewer people that are coming through are being tested. We've seen the positivity rate remain the same or go much higher, actually more than doubled about 2 weeks ago. So that's somewhat concerning. We haven't seen a dramatic decrease in ED outpatient visits. We have seen a decrease in our new case rates. We see a dramatic fall off and then it shoots right back up, and dramatic fall off, then it shoots right back up. So there's a lot of movement in the data right now. So it's hard to pinpoint exactly what's going on, but our rates are still closer or more akin to what they were in November than what they were in October and September. As a matter of fact, I was just looking at that data right before this meeting, and there's a lot of similarity. I looked at our data experience at the beginning of November, the beginning of December, and the beginning of January, and they are very, very similar. Again, some fluctuation day to day, but the overall trend, looking at the same data that the governor reports on, is very, very similar. So the good news, take away the good news on that, is we haven't seen a huge surge above that. Now, there was a lot of concern a few weeks ago with hospital systems being overwhelmed. It's still a concern that that could happen. We still see a lot of folks in ICU with COVID. We still see a lot of use of ICU, just generally speaking. They remain fairly full. It has improved, but there's still some concern there. But our experiences remain fairly stable over time as you look over the last several weeks. So on the one hand, we could have really fallen off over the holidays. We did not. I credit some of that to just people really taking precautions. I think school being out, sports being on hiatus over the holidays probably helped as well. So we sort of net zero through the holidays. No gain, no loss, which is actually okay. We'll take it at this point. If we can stay that way through the rest of the spring, that would be great. I hope we get even better as time goes on, especially as vaccine rolls out. So if there aren't any questions on data, I'll go right into vaccination and what we're seeing and what's going on in county.
So can you just clarify for everyone here, what is our total number of people hospitalized and total number of fatalities within the county?
Hospitalization rate, I don't have on the top of my head right at the moment. We did just get a new data dump, so I'm not sure what that will look like. Deaths in the county is at 28. That is of last week. And I can pull up as soon as I'm done here. I'll type a message in the box after I pull up the number for total hospitalizations. Like I said, I don't have that off the top of my head. I believe it's for 300.
Okay, and are any of them on people under 18?
Yes, I think this was a question that had come up just recently. We have one hospitalization that was confirmed for someone under the age of 18. We have a total of just over 300 people under the age of 18 who have tested positive for COVID-19 or a confirmed COVID case. Of those, right around 200 are clearly no hospitalization. There are 100 where the status of hospitalization is unknown. Likely no hospitalization, but I can't say definitively that. There's one that is confirmed as a hospitalization.
Nan, were you asking hospitalization or fatality for that age group?
I was kind of asking both, but the hospitalization is kind of what I was looking for. How many student age
Right.
people were sick enough to be hospitalized?
Student age, just to clarify, there's one hospitalization under the age of 19. I do not believe that person was of school age.
Oh. Okay.
Gotcha.
Thank you.
Any other questions?
Okay, vaccination. And I should say with the data, particularly in hospitalization, that's one that from the case count, that does not always come back as connecting when a hospitalization occurs. It is entirely possible somebody was a positive COVID case, recorded as a disease, and later was hospitalized and was not updated. That's why we have sometimes that unknown category in the data set. So vaccination effort, two things to just recognize. First off, our vaccination has been going on since December. It was with the Tier 1A group, which was primarily geared towards those taking care of COVID or possible COVID patients, folks in our hospital system, our long-term care residents, and our EMS. So that vaccination effort has been well underway. Long-term care is beginning their second dose shots, actually, with their effort. That is through the pharmacy program. That's not through the health department. And then our hospital system has, as with others, is finishing up the last of their vaccine this week under the governor's order. We are doing a last cleanup of Tier 1A that was eligible tomorrow at a clinic, and then we will be done with Tier 1A among those who are interested in the vaccination. As of right now, we did start actually yesterday our Tier 1B over 80 population, 80 and over. And tomorrow we're doing a follow-up clinic because we got additional vaccine from the state for the Tier 1B 80 population. So we will actually be doing some of that tomorrow as well. Next week, we will shift to 75 and older, plus those who are currently involved in the DD system, children's hospital system, and have a comorbidity on the list. You may have seen that. Week after, we will go down to the 70, the week after the 65. And then eventually the week after that, we'll add in all other folks with comorbidities that are on the list. Now, the school group comes in 2 weeks as well, and we are trying to work through that process as well. The state has not provided quite all the guidance that's needed to make that happen just yet. They're working through making sure all school districts in the state of Ohio have connected with a vaccination partner. Now, we have offered to do that for all of our schools. We're happy to do that. We certainly can. And all of our schools in county have indicated the health department is their vaccination partner at this point. Our understanding is that we will get vaccine just like now. It'll be spread out over a number of weeks. We have been told not to expect that everyone will get vaccinated who's eligible in a school district will get vaccinated in 1 week, that it will be a process just like it is with all the other tiers. We don't know exactly what that looks like yet. As soon as we find out, we will be happy to pass on that information. We are set up to vaccinate up to 500 people in a clinic. And right now, our interested school population runs between 500 and 600 people. That's subject to change, obviously, and subject to availability of vaccine. But we will likely take probably more than 1 week to vaccinate that, given our current vaccine inventory that we've been receiving. So when we were doing Tier 1B, we received an initial vaccine shipment of 200 doses, then 100 doses each of the following 2 weeks. This week, we received 200 doses of Tier 1B vaccine, and then received a supplemental shipment of Tier 1A and Tier 1B vaccine of an additional 300 doses. So that was very unusual for us. Our expectation is about 200 doses a week. So that being the case, it would be at least 3 weeks to get through the school population if we received at least 200 doses specifically designated for schools each week. We don't know that that will be the case, because we'll still be charged with vaccinating Tier 1B population during that same time frame to the 70 and older population. So that will move through. As soon as we find more information, we'll get it taken care of. Clinic times will be set up at that point. It'll be very similar to what we do with the Tier 1A and Tier 1B population. We'll do a closed pod, meaning it will just be for school personnel. We'll send the link to the superintendent to share with staff. More than likely, staff will have to confirm with a school ID or some other identification or a list of eligible participants from the school district to us to check off against at the time of arrival. And then it's a drive-through. Depending on the crowd and the day, when everybody arrives at their appointment time and doesn't come early or come too late, then it's about 15 minutes start to finish to be in the line and go through and get your vaccination. And then there's a waiting period after you're vaccinated for at least 15 minutes to make sure you don't have any side effects from the vaccine. At this point, I've only had a couple of folks that had an issue following vaccination, and it was not a medical issue. It was resolved fairly quickly. But that's what the 15 minutes is for, is to make sure if somebody doesn't feel faint or have another concern, that's addressed before they leave the site. Yesterday, we did 410 vaccinations without an issue, and that included both Tier 1A second dose folks and Tier 1B first dose seniors. So 410 in just over 4 hours. Questions on vaccination?
Yeah, just a clarification. So our teaching staff will be in a group that will be contacted through the school district in order to get registered for their shot. So they will not need to contact Kroger or the website for health department. Their vaccinations will come in a separate group, identified group. Is that correct?
That's our understanding today, that we'll have vaccine that's specifically set aside for that vaccination population to do those as a closed pod. Now, that is subject to change. I will be very honest with you, Mr. Smith. I don't know what the week brings until the week starts. So I have an idea of how much vaccine I'm getting next week. Based on an email from yesterday, I'll know how much vaccine I have next week when it arrives from the courier.
Yeah.
So the same with the school population. As of today, our understanding is just what you described. It'll be a closed pod, closed vaccination. Link will be sent from me to the superintendent, which will go to a private site. They will register for their vaccinations through that private site for that specific clinic. It will not be interspersed with our open clinic like what we're doing right now.
Right. Those in the school know that a lot of times you don't know how your day is going to go until it starts. So certainly appreciate the situation that you're in.
Doctor, my question was, which vaccine is it that's coming in for the teachers and staff?
We do not know at this time which vaccine. So each week we are asked for, put in our request for vaccine. How much can we actually use, meaning what's our throughput we could handle, and which vaccine we would be willing to accept. So each week it's a choice of Moderna or Pfizer. I'll be very candid. I prefer getting Moderna. I will take whatever vaccine the state will give me if they give me lots of it. So the last week we got Pfizer and I got 500 doses this week, whereas Moderna, I've only ever received 200 doses.
Do you ever have any people that come up to the drive-through and have a strong preference, or do they pretty much take whatever you put in their arm?
As of right now, we haven't had anyone indicate a preference. That's certainly a possibility. There's not an option when you come through our drive-through. If that's a concern for someone, they would have to indicate that, and just recognize I can't guarantee what vaccine. Right now, no provider can really guarantee week to week what vaccine they're going to receive, unless they specifically say, I will not accept Pfizer. The drawback of someone like us doing that is it may limit us to 100 doses per week. And I have 7,000 folks who fall into the 65 and older crowd that I'm anxious to vaccinate. So,
Okay, my
take
other
whatever the state
question,
says.
just to clarify, that it sounds like there are some questions that may come up about procedure. Like, for instance, if you have many more teachers trying to get vaccinated than doses come in, like, are those procedures decided at the state level? Is that what you're saying, that they're communicated to you, or are they decided at the Union County Health Department level?
It depends on the procedure you're referring to. So our process for scheduling appointments, that's decided at the local level.
Okay.
The vaccination supply, meaning that whether we get vaccine specific for teachers or not, and the type of vaccine we receive, that's decided at the state level. And how much vaccine is decided at the state level. We don't have an option for that.
But which level decides things like priority if there becomes
Oh, state.
state? Okay.
Now, within a priority group, so the priority groups are identified by the state. The process for getting registered, that's decided locally. And we have the option of subdividing within certain limitations. We can't say we're not going to vaccinate someone, but we could say we're vaccinating a particular group this week, or encourage folks to consider within a system, employment system, how to allocate first, or encourage folks with, like in a hospital system, encouraging folks to start with those in the ICS or the ER before you work your way out from there, for instance. But that would be the limit or extent of sort of that priority process.
Okay, thank you.
Other questions on vaccination?
Yeah, I was just wondering if you can remind everybody about the efficacy, like how long does it take for the vaccine to take effect? How long does it, we don't really know how long it lasts, I'm guessing, but.
Right. Yeah, this vaccine they're still monitoring the long-term success of the vaccine, right? They finished up the trials back in the fall. They're still going to monitor to see how long the antibodies last and some other things of that nature. In terms of immune response, there's a pretty good immune response after the first dose, but it's like any other vaccine, you have to allow about 2 weeks before you start to develop some immunity based on the vaccine. After the second dose, because most of them are 2-dose vaccines, only the Johnson & Johnson, I think, is a single dose, and it's not on market yet. After the second dose, then you would still allow 2 weeks, but we see a fairly strong immune response after the first dose, actually. After the second dose, you're considered fully immunized at that point, though. I don't know if that answered it fully, but that's...
Yep, that's good.
Okay.
Thank you.
I do have a question, Jason. So people who have already, I've heard several different stories, who have already had COVID, are they the last to get the shots, or how does that work?
So there's a recommendation that folks that have recovered from a confirmed case, laboratory confirmed case of COVID-19, have some limited immunity. And that limited immunity is considered to extend 90 days, which is why if you are re-exposed and asymptomatic, you don't have to go back in quarantine. So those folks are asked to self-select to not vaccinate immediately and to delay their vaccination a little while, not necessarily to the end of 90 days, but a little while, so that those who have no protection can get in line, so to speak, and get vaccinated. But that's just a recommendation. It is not a requirement. The only requirement for someone who has had COVID is you cannot be currently ill with COVID or ill at all, nor can you be in quarantine for COVID exposure when you go to get vaccinated.
If you had it before, like if your 90-day immunity thing is up, then you go in your age group?
Then you would go in your age group, yes.
Okay.
Right now, we do not necessarily really consider that issue as a screening mechanism as long as you're not currently quarantined or in isolation for COVID.
Okay,
That's purely a recommendation. It's not a requirement, the 90-day thing.
okay.
Any other questions?
Yep. Questions on vaccination. Just one other update that's actually very positive for the community. If you have just 2 more minutes to indulge me.
Sure.
So we've been trying to work on getting testing strategy within the community for our school systems, because that's a major component of monitoring illness and trying to be responsive of potential outbreaks, shut them down before they start. We have actually purchased some testing devices for the schools to use as the allowable. We're working through with the state right now. Because they are actual testing devices, your school nurses are more than qualified to actually administer the sample acquisition kits, but you have to be identified as basically a laboratory in order to use them, and the reports have to be reported to the state. We're trying to work through those issues right now so that we can get a permanent solution. But in the meantime, the state has been able to get a hold of a number of Binax Now rapid test kits that do not require laboratory status. And we're going to start making those available to all the districts here very soon, within the next couple of weeks. Those are a take-home test. So you actually do a telehealth visit, pull the sample yourself, do it in front of a monitor screen, just like we're doing now for Zoom. And the test results will be read through that telehealth visit. So we're in the process of doing that, working with the school administration to identify a point of contact who can get the appropriate training on this. And then you'll be able to use those with your staff who maybe show symptoms of COVID-like illness, and be able to identify very quickly whether it is COVID or not. And then as time goes on, you can choose to use them in other ways as well. But our recommendation is you begin with staff as critical infrastructure first, and then expand from there. So hopefully by the end of this month, they should be in the school's hands.
Okay. Is that so? I listened to the governor this afternoon, and I think it was Lieutenant Governor actually, one of them talked about having those in-home test kits. I don't know if that's a separate thing or if that's what you're referring to.
That's what we're referring to. Yes, we requested 1,000 of those from the governor, and he made those available to local health departments.
Okay, great. Diane, did you have any questions that you wanted to ask of Jason that relating to anything we're going to talk about later?
No, I think he covered everything that we're going to talk about.
Okay, great.
I guess, I did share our presentation with Jason. We are going to have a discussion about the return or possible return of students in grades K through 4, and kind of aligned to the new quarantine guidelines for that age group. So would you want to talk about that at all, or talk about our experience with school spread thus far?
I can make an off the cuff comment about it if you'd like.
That's perfect.
Okay. I think what we've seen with schools has been very similar. I think the same thing I reported back in the fall last time we spoke. We don't see a lot of evidence. There's not a lot of data that's really out there that speaks to every scenario in every school district, but schools have done a really good job of implementing all the guidance. And what we have seen time and time again, lots of evidence have come out, wearing a mask, especially when both parties wear a mask, really reduces transmission. That's to the positive, because that's what you're doing. You have that, plus you have social distancing. So the combination is really pretty successful. Where we see spread with the student age population usually comes in two ways. And keep in mind, I was on a call yesterday and someone was making a strong case about contact tracing didn't prove something. And while I was listening to it, it wasn't someone who was in public health. I kept thinking, contact tracing is not asking the questions that would support what they were saying. And so even as I make these statements, just keep in mind, contact tracing right now, statewide, has been overwhelmed for months. And so the depth of questions you would need to really research some of these topics, it's not really being collected at that kind of level. So it's really more anecdotal than anything else. We have some support, especially when we look at outbreaks, it's a little different. But when we're talking about the broad sweep of all cases, it's very hard to make many conclusions about them because of the way the data gets collected, just generally speaking, if you're not doing a deep dive. The study that came out from OSU found some results that support some of what I'm saying anecdotally, though. So that's to the positive. In-school transmission, usually when we find it, it becomes pretty obvious if it's between households. The two people had lunch together, or they drove back and forth to school together, or something like that. We see much more spread in extracurricular activities. That's just hands down. If someone were asking me, how do school kids catch COVID-19? I'd say if they're adolescents, if they're 12 to 18 years old, they're getting it in an extracurricular activity. Sports practice, sports transportation. We see a lot in sports transportation over the months. If you're talking about kids less than that, someone else in the home brought it into the household and it's spread among all the kids when we can identify. A lot of times we can't identify where younger kids get it from. It's just not clear in some cases. But household spread seems to be probably at the top of our list, just from the gut. So then when we talk about that quarantine change, I don't see a lot of evidence that's spreading at school. I see more evidence it's probably spreading at home in K through 5. That really seems to be the case. Or with K through 5 extracurriculars, but maybe not structured extracurriculars like sports, but more social extracurricular activities, birthday parties, sleepovers, those sorts of things. And so that's how we see the disease spread generally being. The recommendation on K through 5, it's like everything else. Our superintendents have been really good at staying flexible. Stay flexible. If we move through the K through 5, I think it's worth trying to get the kids back in school. The K through 5 guidance is pretty clear about what the expectation is. We try it and we start to see spread. Well, we know what we have to do at that point, right? Then that's when we have to take steps, and we just have to monitor closely and make adjustments quickly to prevent spread. I would put in the back of your minds that there is a couple of variants of the COVID-19, not COVID-19, but SARS-CoV-2 floating around out there now. And there is some concern that they are more transmissible than the current strain of SARS-CoV-2, which is incredibly transmissible. So that may also change the approach by late March, April, which is when we expect it maybe to become a dominant strain even in Ohio. So bear that in mind. I don't think it should dissuade you from taking steps you feel is prudent. I only mention it so that you remain flexible and pay attention to what your data is showing you, and take steps when you need to.
I think we're just about ready to add flexible to our mission statement anyways this year. So no
Yes.
problem there. No problem there. Okay. Any other questions or comments?
I'd just like to say I really appreciate the fact that you've maintained good and open communication with our superintendent. We've got to continue. I know in discussions, there's not always agreement. There may have been some points where each was questioning the other, but we have to work together, and exchanging information helps to make decisions. So I really appreciate you coming and being part of our meetings over the last several months, and everything that you've done in working not only with our school district, but other school districts in this county. Really appreciate that.
Thank you. I will say one of the bright points of the last 9 months is the opportunity to work with our superintendents, including Superintendent Allen. I have thoroughly enjoyed it, and the robust discussions have come with it. And the fact that I'm changing my cell phone number as soon as we're done has nothing to do with the fact that she has it.
And I feel free to use it all the time, anytime.
I will be submitting a bill to the school board for my text charges.
Todd, did you hear that? Yeah, thank you so much, Jason. And we want to thank your entire team there at the health department. I think you guys are doing a fabulous job.
Yeah.
We're really lucky to have you here in Union County.
Well, thank you very much. And you guys hang in there.
Yeah.
Thank you.
Okay.
Thank you,
Have a good
Jason.
Have a good
Thank
week.
you.
Thanks
All right.
again.
Thank you all.
Thank you.
Okay, Diane, were you going to kind of tie into his presentation? Or is that part of your superintendent report?
We can do it either way, but I'm happy to just follow up since we're on that topic,
Sure.
if you want to handle it that way.
Sure, that sounds good.
Okay, and Marcus will drive the presentation for us. So tonight we wanted to kind of just give you an overview and update on our data platform and really kind of dive a little bit deeper now that we've had a semester experience operating in the hybrid model and working with students. We're going to review the new guidelines. I know in a video went out last week with that information, but I want to just review those with the board, give you an update on our current dashboard, take a deeper dive into specific grade levels, which is kind of what we were talking about with Dr. Orsina, and share some other important data sets, as well as make a recommendation for moving forward. Last week, we sent a video out explaining the new quarantine guidelines for grades K through 6. When we talked to Dr. Orsina, the guidelines are really K-5, but we talked at large about Creekview and our interest in having the same set of guidelines in that building. And he was willing to make that local decision, I guess, to extend that to K-6. So really the difference in this situation is if you are within 3 feet of the contact, it's a traditional or standard 14-day quarantine. If you're within the 3 to 6 foot range, you are considered quarantined, but allowed to come to school. So you should not be participating in extracurriculars. You should be quarantining at home. But because of the safety protocols that schools have put in place, and I think you heard Dr. Orsina talk about that a little bit, you are given permission to attend school as long as that exposure has happened in a classroom or the bus setting, and that all parties have fully implemented safety protocols, including the wearing of face masks appropriately. So both parties would need to have had the face mask over the nose and under the chin, so that is fully covered in order to implement the new strategy. So again, has to happen in a classroom or a bus setting. All safety protocols have to be in place. If that exposure was in the 3 to 6 foot range, then the staff member or student is quarantined but permitted to attend school or class. If outside of that, students or the faculty member should not be participating in other activities due to the exposure. Those are the same slides right from what went out last Friday. We just wanted to review those. So with a look at our current dashboard, as you know, we've been keeping track, and this kind of gives us that overarching view that encompasses our community and our school impact of COVID. Our current score is at 6.5 out of 13. And currently all buildings are experiencing low impacts, and so are departments, which is a positive. We have continued to look at staff absences since we've returned from winter break. As you know, several buildings were at critical staffing levels for a couple weeks, and those weren't all due to COVID or quarantines. I think that's important for everyone to remember that it could be personal leaves or some type of emergency or a scheduled absence or a doctor's appointment or a procedure. There's a variety of reasons, but we do track that because it wouldn't take much to sometimes bump us to a level that we could not cover classes. So we continue to monitor that the collective absence data as well. And honestly, this week we've had a much better week, and things seem to be leveling off really in general. And I think you also heard Dr. Orsina talk about case rates and student rates remain high, but they tend to be leveling off. He talked about there's kind of a zone that you see some change within that zone, but in general, it seems to be leveling off. This slide demonstrates for you the impact of that score, that 6.5 score that we currently have, where that's ranged since August when we returned. So if you go back and look historically to where we are current day, you can see that we had a time right before Halloween that we were approaching a return from those indicators. And then after Halloween, if we all remember, we certainly we had a rough spell. We experienced a rough spell as well as our community. So you can see kind of those dips and peaks as we've moved over time. But lately, we've really stayed in that 6.5, 5.5 range. So this is an interesting, we certainly want to look at multiple data points to kind of check and make sure that we're aligned or we're not experiencing anything out of the norm. And this slide really has a ton of information on it, including the wastewater collection that is being done in Marysville and monitored on the Ohio Department of Health website. And what you can see is really our experience. The red line going through our indicator score is pretty tightly aligned to the experiences happening as it is relative to the wastewater, as it is to our community. So it's just another one of those measures to kind of keep track of where we are. So as we look, so we certainly keep track of the larger scale and kind of that big view of the district. We have been particularly interested in drilling down to get a better understanding of what's happening in the grade band. So if you think of that, the dashboard as that larger feature, we've really worked over winter break into now to really look at specific student experience and what we're seeing in a more, I guess, microscope kind of vision of each grade band. And so this slide kind of lays out for you what the experience has been. When it says K4, you can assume that also includes our Alt-K program. But that it kind of lays out that experience for you. So the blue bar is an indication of the total student body. So for example, our K4 students make up not quite 40% of our entire student body. So you can see how that goes through each grade band. But when you look at K4 in particular, what is kind of one of those pieces of data that pops out and makes you want to dig a little deeper is while the case rate is indicated in yellow, and our case rates are less than 10%, but our quarantine rates for that student population are nearly 40%. So it's about 4 times the amount of quarantines as cases. So you start to ask the question and try to peel those layers off, and quite frankly, it would be an indication that there's high exposure outside of the school day. And you can see 5-8 is a little better aligned. And then when you go to 9-12, it kind of seems to be the opposite, such an increased rate of cases and fewer quarantines. And I think you heard a little bit from Dr. Orsina about how cases in adolescent students certainly seem to be more prevalent and act more in the transmission phase, act more like adults than our younger students. So you can see only about 8.8 of our quarantines in all grades are a result of a school day close contact, and 5 are related to extracurriculars through our programming. So about 78% of our quarantines are a result of close contacts outside of school. And quite frankly, prior to now, we just didn't have, now we have a semester worth of data to reflect on to bring us to this. So we wanted to go a little deeper and really understand staff quarantines, staff cases, student quarantines, and student cases. So we so far have quarantined 271 staff members. 15% of those, so 43 people, have been quarantined due to a close contact with another staff member or student. So that means they were identified as a close contact because they were within that 6 feet margin. Of those cases, none of them have resulted in a positive COVID test. 228 staff members, so the remaining 84%, were actually exposed due to things outside of the school day.
Excuse me, Diane, is that when you say close contact with another staff member or student, does that mean during an actual school day?
Yes.
Okay.
Yep. Maybe it was in reading group. I think you heard Dr. Orsina talk about maybe they had lunch together. So they had the exposure as a result of something that happened within the school day. So then we move to staff cases. So we have over the past semester, we've had 70 staff members test positive. 7 of those, or 10%, were directly linked to our transportation department. We talked about, as you all know, we had to shut down our transportation for a while. There were students identified as close contacts in that process, but none of them turned to a positive case. So we're obviously pleased with that. 90% of those staff cases were not related to any known school case.
So of the people that were quarantined, the staff members that were quarantined, do we know how many actually turned into a positive case?
So let's go back there. Of the staff members that were quarantined, so of the 43, 0 positive cases.
That's due to a school exposure. So we had 280 staff members that were quarantined due to exposure outside of school. Do we know how many of them actually were tested positive?
No, I'll get back to you on that.
Okay.
Okay, so on student quarantines, we had 880 student quarantines to date. 74 students were quarantined as a result of that close contact. And we did have 1 case switch from a quarantine to a positive. I did have a conversation with the parent of that case, and that individual was identified as a close contact on multiple contact lists, so had multiple exposures. So it is not 100% confirmed that it evolved out of this close contact. It would be more of one of those that we're just not sure, but we wanted to list it here as well. 806 students have been quarantined due to exposures outside of the school day. So nearly 92% of those quarantines are related to outside the school day. Student cases, we had 178 student cases to date. The one individual that I was just talking about was the only one that transmitted into a positive case. And then the other 177 positive cases were not related to a school day contact or connections.
Does it make
Diane?
sense, Diane? Real quick, I'm still thinking about that slide where the little kids, the younger kids have a lot of quarantines, but not many cases. I don't know if you or Mark or Dr. Orsino, who's gone, can answer this, but is it that they may be getting COVID, but they're not getting listed as a case because their symptoms are so minor? I know that when you're exposed, you're not necessarily tested. I think that's still true that you typically get tested when you have symptoms. So it strikes me that it might be that the younger kids are actually getting infected but not being listed as cases. Does that make any sense at all?
It does. I would tell you, certainly that would be one case. I think another thing that we've seen happen more frequently is mom tests positive. So she has her whole, or someone in the family test positive. So the whole family is tested and we uncover positive kids that way. That we do know that has been the case in some cases, but I don't know that we would have an exact answer for that situation.
Right, and it seems that how many people get tested that are exposed seems to go up and down. Like it's the recommendations are not the same from week to week and month to month. There are sometimes when everybody who's exposed gets tested, whether they have symptoms or not, and there seems to be other times where they're really encouraging you not to get tested unless you have symptoms. So that confuses the whole set of numbers about who's actually had COVID, including among the little kids who may not be showing many symptoms.
Mr. Smith, did I hear you have a question as well?
I was kind of going along with where Brian was looking. In the elementary grades, I think the statistic was that about 10% of the cases have occurred in the elementary. So that would be about 17, 18 kids. Is that about right?
Back to the bar graph?
Yeah.
Okay, let's go back there. Okay. So that would be out of all elementary schools. And I know Mark's on here if he has the current number of students enrolled in elementary, maybe.
It is just under 2,000 students that are currently enrolled in our elementary. It should be roughly 1,950 students as of earlier this afternoon are enrolled in alt K through 4th.
Okay. Now the statistics as I was looking at them said that about where is it? The
8.57.
Yeah, the 8.57 of the cases is the cases from the whole district. Is that correct?
That is correct. So when we look at all student cases that have occurred throughout the entire district, 8.9% of them, when you were looking at are you talking about the 8.57 or the 8.8? Just talking about all K4, right?
Yeah, all.
Okay, yep.
K4.
So when we look at all student cases that occurred through the entire school district, K through 4 accounted for just over 8.5% of all those cases.
Okay, so that, and we had 178 cases in our student population.
Correct.
Elementary student population, is that correct?
Correct. Yep. So
Okay.
yes.
All right.
So it would be just south of 17 cases, roughly.
Yeah.
Just doing back of the envelope math.
Yeah. Yeah, that's where that's where my thinking was, that because I was trying to get a number.
Yep.
And as opposed to a percentage. Thank you, Mark.
Mm-hmm.
Yeah, we can also pull those off the dashboard for you, Mr. Smith. The numbers.
Okay, I think I'm fine at this point. I think I've got it in my head where we are.
All right, perfect. Okay, Marcus, I think we could move forward. Some things that I think we need to additionally consider, as we look where we are for instructional level, are we do know there's support for return. We know our parent surveys have indicated an interest in returning. Our medical advisory group really talked about a concern for students returning. And our superintendent's advisory group was on board with kind of that tiered return that we discussed October and again in November board meetings. I am going to share with you some staff feedback that we've collected that I think we need to consider as well moving forward, and concerns they have shared. We've also heard from Dr. Orsina that the vaccine is due for all K-12 staff, and we're excited to be able to get that testing strategy he referred to as well as part of our repertoire. As all of you know, I've been asking for a testing strategy for some time. We felt like that would really be a great addition as we look to get back to a more regular schedule. So this week we surveyed staff members and really asked just a few questions. One, about their comfort level with a full in-person learning model. As we've talked, for us, that would be 4 days a week. Still, even if it was a graduated return, starting with K4 and moving up. And then the second question we asked was from a health wellness perspective, their comfort level staying with the hybrid model. And then we ask an open-ended question that asks for if you had concerns about that full in-person return, what were your concerns? There were a lot of responses that talked about the vaccine, a lot of responses related to really understanding what that transition would look like and what the classroom would look like as well. So certainly you can see the blue line indicates favorable responses. It was on a 5-point scale. The red are unfavorable responses, and the gray represents neutral. And we did have really good participation, nearly 500 responses. I think it was 475, 480 out of 620 people on staff. So I'd say we have really good participation. So some concerns about making that jump back to the full in-person instructional model.
So which staff fall into the other category then, the bar that says other?
That would be board office, maintenance, food service.
Okay, so they're the ones that are most, at least, yeah, so they're the most ready, the most comfortable, let's say, the most comfortable returning of all the groups.
Comfortable was the word that we used, but as it related to health and wellness.
Right.
I think some of the uncomfortable responses may have been that they're not sure what it's going to look like.
Right.
So as we, move forward and have additional discussion on exactly what the day is going to look like, how many kids are going to be in the classroom, what, things we're going to put in place, that number potentially could move.
Yeah, I agree. Right. So you've talked about maybe adding some desk shields and things like that, some additional safety things, because obviously to have this gradual return, we're not going to be able to do the 6-foot distance in every classroom. It's going to be closer to that 3 to 4 feet, correct?
You guys are providing a great segue to the next slide.
Oh, okay.
All right.
Well,
So,
good job, man.
I would agree, right? Because the new guidance provides the opportunity of 3 feet of distance, right? Which before our concern was if we bring those kids in and there is an exposure, we're going to be putting kids out on a frequent basis and that radius of students. So the new guidance does create some leniency for that as well. So if we looked at doing an elementary 4-day return with 3 feet of distance and all other safety protocols are in place. So I think we still have to wear masks. We still have to practice washing our hands and cleaning surfaces and all of those things. We could move from the hybrid schedule at the bottom, which we've been at since August, and look to bring a return of elementary 4 days a week. Everyone else in the district would stay hybrid. Then we would look to allow virtual kids, if they chose, to come back at trimester, which is March 1st. So it kind of works out nicely that students who are in hybrid would transition back. And then if we had other students look to transition, families who are not comfortable with the tiered return, then could also go to the virtual academy at any time. That is an option. So if we were to move to this type of format, we would look to have desk barriers as another device of safety protocols. They aren't required, but I do get the concern with changing from 6 to 3. So that would create another barrier that could be used. And really the conversation we had today, which we'd work on future communications, but if we looked at, for example, February 18th as a return date, which I believe is a Thursday. Monday would be President's Day. Tuesday, we can make it a teacher work day. So teachers could prep their rooms, prepare and plan, do some things with principals, whatever needed to happen as that work day. Wednesday would be a traditional C day, and then all students would return for that Thursday, Friday. And really, we've started a lot of school years that way, just a couple of days the first week and then into a full week. And that seemed to make sense to principals when we talked today, really looking at a way to stagger that back and afford some additional time to prepare for that transition. Then what we would look to do is really transition back Creekview after that. Maybe what are our learning lessons from transitioning back at the elementaries, things that we can have in place, and then look to announce a date associated with Creekview in the future. There is not much support, and the guideline restrictions are different for 7-12. But there also is not much support from our health commissioner either at looking at bringing back 7-12. The thinking really is that the transmission of the disease looks different in adolescents than the younger kids from what we know right now. And really the support for that, the younger grades is what exists right now also with Dr. Orsina.
Diane, I wanted to ask you a question about the classrooms. As you know, we're not visiting the buildings so far this year, which is unusual for us. And so I honestly can't picture, let's just talk about the elementary classrooms. Are the kids coming in and just staying in their seat most of the day and not circulating? And are the teachers, are they kind of staying away too? I mean, how does that even, I can't really picture it until it's described.
Right. So we've all struggled we've made this push for collaboration and working together. And this has kind of been the polar opposite approach, right? They are still doing some small group instruction as well with reading groups, but desks are spread out currently. We have moved away from tables in a lot of buildings and back to desk formats. This certainly would cause us to put more desks in classrooms as opposed to using tables so we can get the space. So principals have really looked at classrooms and their layouts. And the tricky part for us really is, Mr. Luke, that some classrooms are different sizes in different buildings. So I can't tell you that it's going to be 19 as a rule or 25 kids as a rule. It's going to be dependent on that classroom. So they're working on some of those strategies as we speak. So it would be much different than the experience you've seen, especially over the past few years where we've promoted collaborative spaces.
But when they do something that is in a group where they're not like sort of isolated at their own desk, are they trying to keep those activities shorter? I mean, is that how you keep under the quarantine triggers?
Yeah, in rotations, small group, they would keep those shorter. And quite frankly, there have been times, that's why you do see quarantines, that we've had a reading group, for example, that fell into needing to be quarantined. So sometimes we have not been able to keep those distances. At that point, the guideline was 6 feet away.
Diane, I know this past summer, as we were looking at the beginning of the year, we were struggling, I should say you were struggling with how to put things together and what recommendations to make. And I know that during June and July, going into the first part of August, there was a lot of anxiety because there were certainly a lot of things that weren't known at that time. And we selected a path, and we've been following that path. And our experience, I think, has done two things. One, it's shown that we can be successful in that process of trying to continue education and get kids in the classroom as much as reasonably possible. But it's also given us the opportunity to gain additional data and information. And we have said all fall, we need more information to be able to move to a different direction. And do you feel like that we have the data? And I know in working with your administrative staff, where are we in terms of the mindset of you, the building principals and those people moving forward on this?
So, I mean, again, when we started in August, I made the comment that there was not a playbook to do, to have school in the middle of a global pandemic. And I would say the playbook still doesn't exist, but we have much more information than we had in August. And I do trust our information and data. I do trust the fact that we are not seeing evidence of school spread. We are worried about our K-4 learners and have continued to be concerned, especially the youngest of those learners who are, Mark said it great in a meeting, they're actually learning to read instead of reading to learn. And there's a different skill set and set of practices that are a part of that experience, K1, 2 especially. And so with the leniency of 3 feet, we feel good about getting those kids back into buildings and pushing forward with the 4-day-a-week schedule. But we also feel very confident that if we have problems, we know how to do hybrid learning pretty well, and we could shift back into that mode if it required us to do so. We're not going to do so at the jeopardy of the health and wellness of our staff or our students. If, kind of like Jason said, flexibility will be the continued phrase that we use as we would move forward in this journey.
Kind of tagging on to your comments, Dick. I kind of think back to the beginning and all the work that went into creating our dashboard, and just, when you talk about trusting the data and everything, right, that dashboard stayed pretty consistent at that 5.5 to 6.5 range. And now as we talk about this, recommendation to return to in-person 4 days a week, how do you reconcile that recommendation with 6.5 on the scoreboard, on the dashboard?
Sure, I think that's a great question. Number one, that dashboard, kind of like I started out, is that overarching image. And I think we have data sets that lie within that that tell us a story, specifically probably with that K4 group more than even when you look at the next grade band up is the 5.8, I think is how we have it categorized there. And, it makes you don't have answers to some of the data points, but we do know that some places that our kids go on the off days have been plagued by COVID. They don't have the same safety protocols in place as we have. So they're getting exposures in those other places. So I think while our dashboard is at the 6.5 mark, as we dig down into that, we have a glaring piece of information that has a call to really restructure things to help mitigate that situation for students.
Mm-hmm.
Yeah.
Like at the beginning, I know we talked about cases in the community and how that may mirror cases in the district. And for me, like looking at the quarantines and the cases, especially K4, that was very comforting to me to know that we've had so few cases there, and that by far the majority of them are contracted outside of the school, and actually like no spread within the school itself. So I think that was kind of that concern and that piece of information that we wanted to feel comfortable with. So yeah, that makes sense to me.
Yeah, I would say the other thing, Mr. Smith, that you asked that I don't think I fully answered was our principals. And that was kind of the conversation and kind of the prompt I gave, that their leadership will matter more than ever. And if they weren't all in, we needed to retract. And they definitely assured me they were all in. They assured me they had lots of questions. And they felt like, if they had the ability to sit down with their staff, they would generate the solutions and ask for help. And we're going to support that moving, forward. But they guaranteed me, and I promised them that I would tell you that. So I didn't want to miss my opportunity. Ms. Savage, I also want to go back to your question. That will be an interesting answer, because for a while, to Mr. Luke's point, if you ended up having any symptoms at one point, then you were an assumed positive. So I'm going to have to go back and see how we tracked that data and if we tracked it by assumed positives at all. So I will follow back up with you with that, with the best answer I can.
Okay. I do have just a couple points. Digital Academy. So we have quite a few kids. I don't know what the exact number is right now. Quite a few kids in Digital Academy, K through 6. So I think that those parents need to understand what we're thinking about, and if that's going to cause people to go to Digital Academy or it's going to cause people to want to return. I think on March 1st is the date for that. I think that is a key factor in how many students are going to be in our classrooms. And you were talking to Mr. Luke about what does the classroom look like this year? Well, one of the benefits I think we had, especially in the fall, and we had kind of a mild fall, we were able to take the students outside quite a bit and move them around. And, you know, kids are still kids, and getting, 25 kids to sit in chairs all day long in one room is going to be challenging, and try and keep them 3 feet plus apart from each other. So those are some things that I'm sure the principals are going to be working on with their staff on how to address some of those issues.
It's the same conversation from today that principals brought up, trying to make allotments for moving. How could we use our unified arts to help support that? All of those types of conversations. How can we engage with what we've learned about asynchronous learning to foster rotations for students? So I think there were a lot of good ideas that have been generated. And certainly the missing piece is if we choose to move forward, how we engage with staff to build that out.
Right.
Yeah, I think it also bears mentioning that if we make this decision and make this move, it's not going to be done recklessly. As you've pointed out, if we find that there are issues and problems, we have experience and can retreat. But I think it's also for parents, it's going to be important to recognize that the school day is still going to look a lot different than what, it has been prior to COVID, and very different from what any of their experiences may have been. Because the focus, while the focus is always on education, there is an increased emphasis on making sure that the education is also presented in a healthy way, and that the staff and the students are equally taken care of in that respect. So,
I mean, I see this as an opportunity for us to start putting into place some of the things that we've learned, and I think we've been talking about this all along, how this has forced us to try new things. And when we do have the opportunity to come back, when everybody has the opportunity to come back, I hope it's not going to be exactly the same way. I don't think anybody in their right mind should expect it to be exactly the same way. So it's scary, but it's also, I think, kind of exciting to be able to say, well, we can do this, or, just try some creative things. But kind of when you talked about the kids moving around, man, I'm just thinking back to the days when we could go and visit the buildings. And I know lots of elementary teachers are very good at doing little dance breaks and things like that with the kids at their desks. And so I have no doubt that they'll have some fun things for the kids to do to stretch and move around a little bit.
I would say also to note that while we can do the 3 feet in the classroom, you still have to have 6 feet for lunch. I think I neglected to talk about that. So they're already eating in different places currently. So the principals were really brainstorming different ways that they could use space to accommodate that 6 feet at lunchtime, because that is still a requirement.
That just reminded me, what about transportation? Do we feel comfortable about transportation?
We do. We talked to Tina, and we will do, we're still going to ask parents who can bring their kids to school if they could continue to help us out and do that. That is a help. Not bringing all of them back. We'll have going all the way up to Creekview right now will allow us a little bit of wiggle room to see where we land with parents as well. So that would be another reason to push off Creekview just a little bit longer. So we'll be doing that. We have Jonathan is preparing a communication for families pending this meeting where we'll be asking some of those same things so that we can get a gauge for that. But Tina is confident that we should be good moving forward.
Diane, I just looked at the calendar and it looks like if I understand your recommendation correctly, we're giving ourselves about almost 4 weeks before we implement anything. And what if we find some issues or problems between now and then?
Right. Well, we're pretty good at being problem solvers, first of all. So we're going to work through those types of things. Again, I mean, I would add, let's pretend that we make a decision and we are good with with bringing this back in a staggered, gradual manner. And then let's say the variant hits early and wipes us out. We've said all year we'll remain flexible, and if we were going to be in a position that we needed to make a change, we would make that change. So we will continue to communicate with families at minimum weekly, which we do now, on updates and how things are transpiring, information we need from them, so that we can make the transition as smooth as possible. But if something occurs that would, shoot a hole in the plan, we would be definitely willing to say, hey, we're going to have to stick with hybrid after all. We've done a nice job at staying consistent, and we're pretty proud of that. We haven't been a district that's had to go back and forth. So this leap, we'd like to make as a pretty solid commitment. Right. And just like we did to start the year. So we will work hard to solve those problems and get things aligned.
Thank you.
Does anybody else have any questions or comments of Diane? I know one thing that kind of struck me is just it's one of those things to make sure that people don't think that we take for granted the great work that everybody in our district has done to keep our students and staff safe. When you look at that, when you look at all the data that you presented, that tells a pretty good story. So I just want to thank everyone, maintenance, custodians, teachers, students, everyone who's following those protocols. So
yeah, that's the addition I would make. It will be a heavy lift while we have given ourselves 4 weeks. It is a heavy lift. I know we have 51 desks to get to Naven that, we have to move from another location. So logistically, I know that from a parent perspective, that might seem like a long time, but there are several pieces that have to fall in place to make that happen. So you say 4 weeks seems like a long time. I have a little bit of angst, but
that'll pass very quickly, I know.
yes, yeah.
So one thing that I wanted to point out is that we're kind of in the position where we were in early October, where we were starting out on a good trend and it was looking like really positive. And what made all the difference is how our community stuck with the guidelines and maintained mask wearing and social distancing as much as possible, and avoid that drop off. So we had that huge drop off then at the end of October, but we've been working our way back up again. So we're asking the community to please be supportive. We want the kids back in school. Many, many parents want the schools. The medical community has come in on the side of wanting kids back in the schools. Some of our admin and other groups have come back in on that side. It's up to the community to help keep us moving in this positive manner to avoid a big spike, because if we get another big spike, we're kind of going to be back in that same situation we were in at the end of October, and we don't want to go back there.
That just made me think about vaccines too. I did want to ask a question because I know Brian had asked Dr. Orsina about prioritizing vaccines and stuff. So have you thought about that with our staff?
Great, I'm glad you said that. We have talked about that at length, and what we are urging. I know Adam from Fairbanks and I have the same philosophy. You heard pretty clearly that Dr. Orsina is never exactly sure how many doses. So we've asked them to consider the size of each district and allot a equivalent amount of whatever the number is each week. And then for us at Marysville, we would like to prioritize, for example, our C teachers first. Those teachers are, in attendance with students every day, certainly in some different situations than the rest of our staff. So they would be our priority. Then we would do it off student exposure base. So we look to do K4 and move that direction from there, with people functioning out of the board office being absolutely last. So we do have staff members that go in directly and work with PD and et cetera. That would be the bottom tier because they have the least amount of contact with students. So in a range, that's what we're thinking at this point. But still without a clear directive of how they're going to situate those, that's our thinking at this point. The other thing I asked Dr. Orsina to do, and he has scheduled, and I don't have the date, so I can get it to the board. He has scheduled a educator Zoom session. Really, we were getting asked a lot of questions, kind of like Brian was asking tonight, that we just didn't feel like we were the medical experts. So Lynette wasn't trying to answer those or be the middleman, or myself. He'll be hosting that Zoom session. So any educator in Union County can attend and ask questions about the vaccine or reactions or anything along those lines, and get some kind of like a town hall and get some answers. So we did send that out in a staff email this week. So we're excited for that to happen.
Could I mention, Diane, that I don't know if you've been following how some of the rollouts have been happening. I'm not saying all of them are working this way, but for some of them, they open up for a group, and that group is expected to go online or pick up the phone, and they're scheduled on a first come, first served basis. Okay. And what's been happening in some cases, because of the number of doses that have come in, is people who don't call in for 30 minutes are just shut out for that week. You follow me? So part of what I was trying to figure out with Dr. Orsina is that likely to happen with our school people? Let's say you have a list of the first 200 people in the district that you think are the highest priority to get vaccinated, right? And that week, 100 doses come in. Are we expecting them to call in and this sort of, it's like you're getting tickets for the Rolling Stones or something, you know? Is it going to be organized a little less hectic than that? You follow me?
I think our plan internally, we're kind of waiting for his lead, but our plan internally is to have that. We've already asked staff who are interested to give us their names. We have those. We've started to organize them based on the criteria I just talked about. So if Jason says, Diane, you're going to get 25 of our 100 seats today, then we can have the top 25 people. I don't think we can make their appointments for them. I think they have to do that, but we would have the mechanism to reach out to them automatically, and those would be our 25. That's what we would like to do.
Well, I think that makes sense, because I think it adds unnecessary stress if you have to also like be on 9:01 in the morning or something, you know.
Right.
Yeah.
Well, I said, what if Adam gets the email before me and I don't get it out to the staff and Fairbanks gets all the vaccines, right? So I'm hoping that it
Yeah.
just works a little bit different.
It sounds like you have a couple of weeks to finalize and iron out these issues.
Yeah, well, and I like the fact that he did say there will be an allotment set aside specifically for the teachers,
Right.
hopefully divided up among the 3 school districts. But it sounded like to me that it's going to work through the superintendents, and so that I think Brian makes a great point that that should help alleviate some of the stress. In that our teachers will know you're in line,
Right.
you're going to get your vaccine well before a lot of the general population does, and hopefully then we can move forward. So,
And tonight is the first time that it has been very clear to me that a certain amount of those would be earmarked for educators. So I think that's pretty exciting news as well.
Mhm. Mrs. Powers, did you have any comments or questions? Just want to make sure we all have a chance to.
Nope,
ask for-
you guys are covering them all. So
Okay.
I've gotten all my notes written down. So thank you.
Okay, sure. Okay, well, if we don't have any more comments or questions, I would accept the motion to approve this a tiered plan to bring our K-4 students back 4 days a week on February 18th, or if somebody has a similar motion and would be interested in making that, I think it's important that we're in this as a team, and if we feel good about the data, the presentation, then I would accept that.
I'll make the motion that we adopt the recommendation of the superintendent to begin a tiered return starting February the 18th.
Do I have a second?
Second.
Second by Ms. Powers. Any other comments, questions?
No, I would say to people that might watch this that the members of the board were given advance notice of what this recommendation was. And so we've had time to ask questions of Diane to clarify what we're going to vote on. This is not a situation where she sprung something on us in the last moment, and we're having to make a decision without individual, thoughtful approach to it. So,
And I think also just the whole idea that it really has been our goal from the onset to find a way to get our kids back in school. We know that face-to-face is just going to be better for them, and so it's been nice to see all the data, and then especially with this presentation, the ability to use that full semester's worth of data and really drill down and get a little bit more detailed with the different age groups. And then on top of that, hearing from Dr. Orsina, his experience as our health commissioner and what he's been seeing out in the community and what he's seen in really every school district. So I guess maybe the other comment is just the concerns of the staff, and we do hear those concerns, and like you said, Mr. Smith, just the fact that Diane has spent a lot of time talking to the principals and really asked them to commit and let her know if they have any concerns. I think that's key. They are our educational, instructional leaders in the building, so I think their staffs looked up to them and hopefully trust them and feel like they're going to be trying to put things, just in as safe a setting as possible for everybody. And the other, I guess the only other thing is just that as a board, we are willing to support their needs. So.
Yeah, and I would second what Dick said, that this is an important decision, but it's not one that's been sprung on us. And we had a chance to ask questions, including whether it's going to be difficult or easy to get the extra equipment that might be needed in the classrooms, and that keep them safe. And that's definitely going to happen.
I just want to make sure that we engage with the teachers in the classrooms and make sure that we understand what they need, what they need to be successful in their job with all the students coming back.
And I think that we have some time to be able to do that. And I have confidence knowing the principals that we have in our school district. I know they're going to be spending the next several weeks sitting down and having some real heart-to-heart conversations with our staff. We've been saying that we're all in this together, but that doesn't necessarily mean that everybody is in exactly the same spot mentally. And certainly we are not discounting any concerns or questions that people may have. And but I think as I look at the data, I think the K-4 is significantly different than some of the other age groups in terms of the data that we've had. We've said that the decisions were going to be made based on data and information that we have on hand, recommendations from the medical community and from others, and that our decisions would be based on what we felt were best for the students in our school district, and not based on what other school districts were going to do. And we have resisted when other school districts were making other decisions and so forth. And I really feel that we have reached a point where we can, in my mind, approve this move. We have some time to look at it and get it implemented and make sure it's done in the right way, with everybody being aware that if the future holds different challenges and we run into roadblocks that we're not able to overcome, that we will choose a different direction. So.
Okay, any other comments or questions?
The only other question I had is the families that want to go into the virtual academy or come out of it. Is there a day when they need to make that decision and communicate to the district?
So you broke up a little bit, but I think it's about both directions of virtual academy. Did I catch?
Yeah.
Okay.
And when they would need to make that decision?
Parents that are currently enrolled in virtual academy can come back March 1st. So we will do a declaration kind of form where they inform us that it's their intent to return March 1st, because that's trimester day. That's kind of been the setup the whole time. We'll also have an opportunity for parents to give us feedback if they want to go to virtual academy in our communication tomorrow. So all that will be outlined for parents.
But those parents, would those parents be able to move at when we would switch to the 4 days a week?
They can move now, they can move anytime.
Okay.
To virtual academy, just not the other direction.
Does that answer your question, Brian?
No, I was wondering when they have to decide, not when they can do it, but when do they have to tell the district that?
I don't know that we have specified a certain date. that it has to be a drop dead date because we've provided flexibility and time for parents to ask questions. So, we'll outline that process, and then I'll talk to Jonathan and see if we want to put a date to it. But we don't have any of that established at this point.
Thank you.
Mm-hmm.
Okay, anything else? If not, I'd take a roll call.
Real quick, I just want to make sure I have Dick's motion correct. I have accept recommendation of superintendent to begin tiered return to school approach beginning February 18th for grades K through 4.
Yeah,
Is that okay?
yes,
Okay, good. Mr. Smith,
yes,
Ms. Powers,
Yes.
Mr. Luke,
Yes.
Ms. Savage,
Yes.
Ms. Devine.
Yes, motion carries. Thank you. That's some good discussion there. And as always, we have emails. Feel free to call the board office. People have questions, concerns. We always want to hear them. So next up, is there any public participation?
There is not.
Okay. Then moving on to our report section. Do we have a high point report, Ms. Savage?
So just a quick High Point report. Groundbreaking for the updated High Point facilities will be February 4th. We'll be moving forward this month with superintendent and treasurer evaluations and new committee assignments. We have 3 new board members coming on board from the November election from various districts, and working on major construction updates is what we're focusing on.
Okay, that's it. Okay, that's okay. Next, then we have the superintendent report.
Thought you were done, right? Here we go. I wanted to let you know that we have been in contact with the URI delegates, and we are postponing the exchange due to COVID still being prevalent in both our communities. So we'll postpone that. I did share with you, we've been holding data meetings, and I shared with you some of the highlights in the update last week, but the high school is exploring block scheduling and kind of revamping some things as a result of their experiences this year. So I know Mrs. Devine talked about maybe we'll see some changes as a result of the experience. Both schools have established virtual tours for the 8th graders to help with the declaration process, and are holding meetings with parents and et cetera to answer questions. So that process is underway. ECH had dedicated a lot of time to increasing ACT targets, and they are seeing an increase in scores as a result of their work. So they want to continue some of the focus there. And I would say several buildings are going back to revisit now. They felt like their tier 2 and tier 3 opportunities for students were very robust and strong and operating with good fidelity. And so they're going back and looking at tier 1 instruction and targeted in-class interventions. So what are the things we're doing as a part of our daily instruction to prevent maybe students from going into tier 2, tier 3 opportunities? So it's been really great work. Tri-Academy, we had a great conversation. Jen is volunteered with a staff member to work with students at the high school that they've already identified as potential at-risk learners, and working on strategies with students at the high school to try to increase their success rate at MHS as opposed to maybe ending up at Tri-Academy. So pretty excited to see that partnership and outreach. So I thought that was good. I did mention that we have started graduation meetings. So we are working with health department and Kenny and Tom are also hosting Zoom sessions with families and seniors to try to create a ceremony that's reflective of some of the things they like to see. Last year's YO people were very concerned. The feedback we received was extremely positive. So they're trying to really search and get some information so that we can build that ceremony and hopefully have it in the new stadium and things of that nature. Todd and I will start being a part of some conversations about some of the new solar panel fields that are coming in Union County. So look for information on that. Currently, we're in the middle of diagnostic testing for our grades, and we'll be going into some social emotional assessments following. So look for me to update that in the next upcoming months. I also shared with you an exciting opportunity that came our way through Miami University and several other community partners, where we're going to be a part of the Ohio School Wellness Program. And really their focus is on implementing a student assistant model for the state. And they've asked Marysville actually to kind of be the lead, since we have several structures already in place, and they were pleased with some of the work we were doing. It was pretty unexpected, but we're pretty excited that they noticed some of the things that were taking place here. So really they're designed to start that assistance program, look at tier 2 and 3 supports for students. And then also one of the things we've been talking a lot about, which is one of their outcomes, is promoting mental health and wellness among staff and administrators. So we're excited to be a part of that work and with that collaboration.
Good stuff. Does anyone have questions of Diane? Well, congratulations on being a part of that school wellness initiative. I think that's so exciting. You know, they've recognized our good work, but as that lead, I just feel like we're going to be gaining a lot of new information ourselves. So just makes it become even better. So wonderful. Treasury report.
Hey, I do have a PowerPoint. If Marcus could bring that up, please. Thank you very much. So the first page here, I just wanted to just kind of give a brief rundown of COVID-related funding changes, because we've had some increases in funding, we've had some decreases in funding. There's a lot of different ways you could spend this, because you could bring in expenditures where some expenditures have gone down, other expenditures have gone up. But this is really just focusing just on on revenues. So as far as decreases, the areas we've really seen the decreases is in our state foundation funding. And in each year, fiscal year 20, which was last year, and then fiscal 21, which is this year, each year we were reduced by $1 million. So we've lost a total of $2 million. We don't know yet what next year's state funding is going to look like. I think we anticipate the governor will be releasing his version of what the new state budget will look like, probably sometime in February or March. So hopefully that'll give us some indication of whether that funding level is going to be brought back up to where it was back in fiscal year 19, replacing that $1 million that we lost. So that kind of stay tuned. We'll see where that goes. On the increase side, I kind of broke it into two sections. The first three there, the CRF, broadband, and then the BWC, I put those separate because they really don't help offset the $2 million, in my opinion. So for instance, the CRF funding, that's the COVID relief fund, we received $275,000 of additional funding, but we turned around and used all of that money for expenses that we wouldn't have had to do otherwise if it weren't for the pandemic. The same thing would be said for the broadband fund. That was $150,000. So between those two funds, we used all of that funding for like social distancing. We used for masks and dividers for the classroom desks. We spent a lot of money of the CRF creating the virtual academy and some of the remote learning curriculum that we needed. We spent some money on sanitizing supplies and equipment, and pretty much the entirety of the broadband grant was spent on hotspots and internet access for students in the area and in the district that didn't have it to be able to do the remote learning that we needed. Then also the BWC rebate, I threw that one in there because that's, in essence, that's money that was ours to begin with, because the BWC has overcharged us, and that's why they're giving the money back. And that money that we would have gotten regardless of COVID or not. That's $638,000. The next set is money that I would look at that is really helping to offset our $2 million in losses. So that first round of ESSER we received was $298,000. We haven't spent, other than just a couple $1,000s on some supplies, we haven't spent any of that money yet. I was kind of holding that back to see, you know, what was the next thing that was going to happen with the pandemic and what would we need to do with that money. As of now, the plan is to use that money directly to offset the loss of the foundation funding, and we would use that on staff salaries. We were just recently made aware that there's a second round of the federal ESSER money coming. We don't know yet for sure what the amount is going to be. I've seen a projection for our district that says $532,000, but the state hasn't released actual yet. We should know near the end of the month, if not the beginning of February. The state received 4 times the amount that they received the first time around. But as you can tell, that $532,000 is not 4 times what we received the first time around. So I'm hopeful the number may go up, or it could be that they're targeting certain districts with more funding than what we're getting. So we'll see what happens there. And then also in January or the end of December, we received the BWC dividend of $795,000. They're calling this different than the rebate. And what the way I see it is this is just the state legislature's way of, the BWC had a lot of money sitting there, and how can they help schools to make up for this loss in state funding? And that's, they pulled that kind of the rob Peter to pay Paul kind of principle. They took money from the BWC to give it to the schools, and we're very happy to take it. But again, that's kind of goes to show where the BWC has been overcharging entities and governments for quite some time to have that type of a balance to give back. But in total, that's 1.625 million of money that we should be able to use to directly offset the loss of the $2 million. You know, really, if you look at some of the savings that we'd had, especially during the remote learning, savings we had on utilities from the buildings being closed, savings we had on supplies and things like that, we're probably right at about even. So, you know, honestly, overall things are, you know, from a finance standpoint, we're pretty well at about the break-even point compared to where we started. So that's good news. Any questions on that before I move forward?
Thanks for sharing that.
Yeah. Okay. So the next thing we're going to talk about is what I think is some great news, a project that we've been talking about probably for the last several years, but we just never quite had the right timing or the right funding to do it, is the main gymnasium at the high school. So we're looking at doing that project starting in the spring potentially. A couple of different things that we're looking at there. There's 3 main aspects of that have needed replaced for quite some time. You have the HVAC system. That's a big eyesore that you can just look up at the ceiling and see. That's an outdated, inefficient system that does not have air conditioning. There's been multiple times where that system leaks and either creates a student safety issue with slippage on the floor, or it has actually caused damage to the wooden gym floor. There's regularly costly service that needs done. The second item to look at would be the bleachers. The bleachers, as code and compliance has evolved over the years, we now have bleachers that no longer meet those regulations. They're a 30-year-old motor system that moves the bleachers in and out that no longer works, and then no longer can we buy parts to fix, and that's created issues, safety issues, where the bleachers don't quite move out like they're supposed to, and there's spacing issues and things like that. There's no ADA compliant features. There's no place for wheelchairs. There's no handrails and those kinds of things. And then the third issue that we're looking at is the floor, which if you look at the floor now, everything looks good, but the way those gym floors work, they can only be sanded so many times. And we've been told that the last time we sanded that gym floor down is the last time. We can't do it again. So we would need to replace that floor as well. And, you know, one of the issues we've had over the past is, you know, how do you do this? What can you do? Because it's a relatively expensive project to do it all, but it doesn't make sense to fix the floor and still have a leaky HVAC system. It doesn't make sense to fix the bleachers and then not do the floor, because then when it came time to do the floor, you'd have to tear the bleachers out. And so really the only way to do it is to do it all at once. So that's what we're looking to do. Some of the highlights of what we're looking to do would be putting in new ADA compliant bleachers. These would be safer and more comfortable seating, would provide flexible seating that would also allow wheelchair access. We would be also creating a media platform on the top of the bleachers on the west wall. It's kind of hard to say the exact seating capacity of our current bleachers because it's just a flat bench. But what we'd be looking at with the new seating is a capacity slightly over 2,000. We estimate the current capacity at around 1,600. So it would be a little bit of growth in capacity. The HVAC system that we would be putting in would no longer be an under the roof system. This would be a system that would be above the roof. So it would no longer be a big system that you would see in there. This would also have air conditioning. So that would be an upgrade there as well. So the floor and the bleachers, we would be looking to purchase through Sourcewell, which is cooperative purchasing. It's basically already bid through the state program. So they've already kind of did the bidding for us to make sure we're getting the best pricing available. The HVAC system, we would be doing a bid process for that. So we would most likely be coming to the board possibly in February for approval of the bids there. Estimated costs. So for the bleachers, we're looking at an estimated cost of $270,000. The floor is an estimate of $245,000. And the HVAC system is an estimate of $600,000. So the total cost of the project, we're estimating at $1,115,000. The funding to pay for this project, it would be coming out of the Permanent Improvement Fund. Why the timing works out now to do it is we're actually very caught up on our asphalt work. We're to a point where it makes more sense to fix the safety issues in the gym as opposed to putting that money towards asphalt that is really pretty good in the district. So if you look at a 2-year budget cycle in our permanent improvement forecast, by doing this project that cost over $1 million, we're moving some money around in the asphalt budget to do that. We're actually going to be able to do this project without increasing the budget over that 2-year period by $1. Shows the great flexibility we have with our permanent improvement forecast. Shows that we've been very responsible with, keeping an ending cash balance that gives us the flexibility to do something like this. And also, even with moving the money from asphalt, we're still leaving money there that will allow for repairs and certain small projects that'll still need to be done. Any questions on the project?
I'm just happy to hear about that. I thinking back when our daughter graduated in 2007, and it had to be inside in the gymnasium, and it was like 85 and 90% humidity outside. It was not comfortable.
Right.
No, I will second Sue's comment about that using
We were there.
the facility in the spring for graduations, standing at the door and just sweat pouring down, trying to make sure everybody gets in safe. I know also that we are constantly looking to try to not only maintain the facilities we have, but upgrade the facilities. We have had periods of time in the past where maintenance was deferred, where things were let to go, and in the long run, it becomes even more expensive. And I am absolutely thrilled to hear that we're in a position to be able to get this done. It's something that I've mentioned from time to time to various people, so I'm excited to see this move forward. And as you look overall at the athletic facilities in our district, I think our gymnasium is one that needs attention. And I think when it's completed, that our facilities throughout the district for all the different sports that we have will be enhanced. And so I'm really excited about this. This is a great opportunity. And I want to thank you very much for the diligence that you've applied in terms of managing the school district's money, looking for ways to save money so that we're in a position to be able to do some things like this.
Thank you.
Yes. And I think the only other comment is just that while I was jokingly talking about how hot it was in there for the graduation, the real impact is just improving the safety for our students and for families that are coming in to watch games, and just how important that really is. So
Right.
Thank you, Todd.
Yeah, and so then the last thing, as we talked about this project coming up, I was asked about the TIF revenue. That is one of the ways that our permanent improvement fund is funded. So just talk about some of the high points of that and just what direction it's been going over the last couple of years. So if you look in fiscal year 19 compared to the prior year, our TIF revenue increased by 2.6% or $57,000. So, relatively steady there. But then the following year, last year, it increased by 9.6%, which was an increase of $217,000. And again, these are based on values in the TIF area. So typically, once the value goes up, it's historically so far it's stayed up there, and that increase continues. We continue to amount. So if you look at fiscal year 20, the total revenue at that point was just under $2.5 million, keeping in mind that $1.7 million of that goes to the general fund as part of our levy promise when we did the no new millage PI levy. So if you look at what we've gotten so far this year, we get our TIF revenue and basically one in the first half of the fiscal year and then one payment in the second half of the fiscal year. So we've received one payment so far. And if you compare that payment to the same half of last year, it was an increase of 25% or an increase to $281,000. In the permanent improvement forecast, I would say conservatively projected a 2% increase. So if the second half payment is even just the same as what we received last year, we'd be looking at receiving additional $280,000 to the PI forecast that's currently not budgeted. So right now, I'd say we're positioned well for the PI forecast to improve a little bit.
Great news.
Yeah,
Thank you. Thank you.
and that's it for me.
Okay. I do want to comment though, Todd, you need to toot your horn a little bit, because we did find out that you and your department received the Auditor of State Award for fiscal year 2019 audit. So congratulations.
Thank you.
Congratulations.
Thank you.
Okay, for any questions, any other questions for Todd? Okay. For my report, just a reminder, this coming Monday, January 25th, we are going to be doing our mid-year evaluations of our superintendent and treasurer. And as you know, we are required to evaluate them annually, but historically we've done both that mid-year and the end of year. Student achievement report, I sent that out earlier this week, and as you recall, we're kind of going over these 6 areas that people feel like the school board can really make an impact on student achievement. So we've gone over vision, accountability, policy, community engagement, and the 5th one is public school advocacy. So I sent you some information about that, and really there were 4 areas that I thought just kind of a good reminder for all of us, that as advocates for public education and for our district specifically, it's important that we're always seeking resources to expand opportunities for our students, and also just advocate for public education in our district. We want to be advocating for our families and children through strong partnerships. We want to be celebrating our students' achievements, and then also promoting school board service as a meaningful way to contribute to society. And maybe something else that I need to point out is just, I know that Dick is our legislative liaison, and obviously as an advocate for public education, those relationships that we have with our legislators are so important. And we have a new legislator this year, Bill Reinecke. So I know Dick will talk about that a little bit in his report, but I want to thank him for the work that he's done advocating for our district and for public education, and for all of us. I know if there's ever a time where Dick needs help and he wants all of us to jump on the bandwagon, we're ready to do that if needed. Let's see, I've attended a couple of chamber events. At a Marysville Business Association meeting yesterday, Jason Duff of Small Nation was the guest speaker. And if you're not familiar with Mr. Duff, he's the one who's really responsible for all of the renovations in Uptown Bell Fountain. And now he's focusing some of his efforts, he and his team are focusing their efforts here in Marysville. And they're going to be renovating the current MEC building, the Marysville Entrepreneurial Center. And so I'm really excited to hear that. I feel like there's some great opportunities for our business students to learn from Mr. Duff. And so at some point, when we're at a point where it makes sense to try and make some connections, I'd love to get that started. It kind of goes to that whole advocacy that we were talking about. And also, as Diane had pointed out, we have some solar energy projects planned for our community, and Eric Phillips of the chamber was just letting me know, and Diane and Todd have told us too, but that Diane and Todd are part of some bi-weekly calls. But at least one of the farms is located in our school district. And I listened to a presentation from 2 of the project managers the other day, and one of them was specifically talking about partnerships with education. So again, it's exciting. I think that businesses in general are really tuned into that now. So puts us in a great spot. So that's really great to hear. As far as continuing education opportunities for us, there's a OSBA town hall on January 28th about vaccinations in schools. Those are always free and you can register on their website. And then, in the past, they've always offered this board member 201, which is like just kind of a nice refresher course for how to be a good board member. And they are doing something different this year, kind of as the result of COVID. They're trying some new things. And so they're going to be offering that series that I think I mentioned quite a while ago, covering these 6 areas that I've been sending out in my student achievement reports. So those will be some webinars that will be available. And just encourage you to go to their website and check out their on-demand webinars that are available in just a lot of different subject areas. And usually they're $50 to $100 to attend. So they're reasonably priced. And I think you usually get a lot of good information from them. So that's my report. How about a legislative report, Mr. Smith?
The legislative report I've just sent to you, so hopefully you receive it, and hopefully I sent the right one. But it's pretty brief this month, as the state legislative sessions have not started yet at this point. As Sue mentioned, we have a new legislature, new state senator, Bill Renicky, and I have sent some messages to his office introducing myself and kind of outlining for them what I hope to be able to do. Also, I had a phone conversation with Tracy Richardson. I've had a number of conversations with her chief of staff. Talked with her the other day, and we really focused on 3 things, and that was state testing, the state report card, and bus safety, a bill that was not passed in the last session that we would like to see acted on. She expressed a lot of interest in our data collection, specifically the social emotional aspects of it. And so we're going to set up hopefully a monthly phone call to continue conversations on that. And I told her that I would follow up with data and the possibility of phone calls or maybe a Zoom meeting or something like that with Diane Mark Gallagher to give her access to what we're doing in the district. She was very interested in what Diane mentioned in terms of the Miami program and how that might unfold. I listened to a Columbus Metropolitan Club presentation. Lieutenant Governor was part of that. And he did talk about Union County, specifically Allen Township and Starlink, because the focus of this was on expanding broadband. And the meeting basically was informative that broadband needs to expand. And but it was nice to hear the Lieutenant Governor speak in very positive ways, because broadband not only would be basic improvements in that area, would not only benefit education and our district specifically, but it also is fundamental to job growth and general economic well-being of our school district or our community in large. So that's the gist of my report. So.
Thank you very much. Any questions of Dick? All right. Do we have any safety report this month, Ms. Powers?
Yes, ma'am. I want to give everybody a website. It's Prevention Action Alliance. The website is contact@preventionactionalliance.org. This is something that we need to be on the lookout for, and also parents, to steer youth clear of psychedelics that seem to be returning. The mushrooms, the active ingredient in their psilocybin has been potentially spotlighted recently for evaluating its potential for medical benefits. But that measure can also provide a false sense of safety around its use, especially among our teens. So we should be looking this up, kind of educating ourselves on this, because as we discuss the shift in attitude, the drugs in the United States, voters in Oregon legalized psilocybin, and voters in Colorado decriminalized its use. So this can reduce young people's perception of it being a safe drug. Regardless of law or potential medical uses, however, psilocybin is a powerful, dangerous, hallucinant drug, and youth must be made clearly aware of the dangers and empowered to steer clear of this drug. So I just wanted to get that website out so everybody can get, and the parents can kind of look into this, because it could be very dangerous, in fact, lethal to kids. So that's it.
And that is Jonathan still part of this committee? Jonathan Langhouse?
You know what? I believe he is, yes.
Okay, that's good.
So it would be nice though for us to get this website out. I think parents need to really educate themselves, especially since this is making a comeback now.
Right.
And it's going to be more available for kids to get their hands on.
Great, good information. Thank you, Amy.
Mhm.
Okay, we are now to the business part of our meeting. So I would accept a motion to approve draft minutes for both our December 10th regular meeting and our January 11th organizational meeting.
So moved.
Motion by Mr. Smith.
Second.
I'm going to say second for Ms. Savage.
All right.
Any comments, questions, corrections? If not, roll call, please.
Mr. Smith,
Yes.
Ms. Savage,
Yes.
Mr. Luke,
Yes.
Ms. Powers,
Yes.
Ms. Devine.
Yes, motion carries. Next, I would accept a motion to approve the treasure items.
So moved.
Motion by Ms. Powers,
Second.
second by Ms. Savage. Anything you'd like to go over, Todd?
Not really. It's just our normal, our financials, and then just one minor appropriations change. The only thing I would point out and just recognize there's a lot of donors on there this month. A lot of our stadium pledges come in December. So just point out a lot of our donors this month.
Yeah, I noticed that too. Obviously we thank everybody for their support. Their stadium project, Tri Academy, Honda for, I think it was Honda for ECHS, the robotics program. So it's just really nice to have those extra funds come in. Okay, how about roll call?
Ms. Powers,
Yes.
Ms. Savage,
Yes.
Mr. Luke,
Yes.
Mr. Smith,
Yes.
Ms. Devine.
Yes, motion carries. Next, I would accept a motion to approve our treasurer contract renewal.
So moved.
Motion by Mr. Smith,
Second.
second by Ms. Powers. I would like to make a few comments here, and I'm sure others will as well. But this is something by law we are required to renew contracts within a certain time frame. And Todd's time frame actually started in January of last year. But I thought he was pretty thoughtful. He said, we don't need to rush into this right now. We've got a pandemic to deal with. And so, we put it off for a while. And I think that was a really smart move because it allowed us to kind of let the dust settle, see where we are financially. And then the other part of our process, we always look at some salary surveys because I think it's very important that we are paying our treasurer and our superintendent in a reasonable manner and comparable to others in our district. And so we get salary survey information from our educational service center. It includes about 31 other school districts. And then finally, as we are looking over this contract and everything, we asked our legal counsel to review it as well. And just kind of gives us that extra comfort level. And I know our legal counsel reviewed this and felt like it was very much in line with others in our area. And so just to kind of point out a few of the highlights, this is a 5-year extension. In the bond area, we did add an option to, instead of having a surety bond, to use the dishonesty policy. And that was the policy that we recently updated. It saves us some money doing that. And then one other area that was new in here had to do with treasurer incapacity. And so this was something that our legal counsel said she'd seen in other contracts. It just kind of spells out, it gives everybody some guidelines and understanding of what would happen should Todd be in a bad accident or have some kind of medical problem, things like that. So, anyways, I think there were just some nice little cleanup things added to this. And so that's just that's the more detailed side of it. And then of course we come to the reason why we wanted to extend it. And I know that I have some board members that would like to make some comments. So I'm opening the floor.
Well, I'll go first.
Okay.
Say that Todd is, as you were talking about last January, Todd saying, let's not rush into this. Todd has always put our district at the forefront of every decision, every conversation that I've ever had. And he is diligent. He is creative. He has organized and set up lines of communication with all the school buildings in our district, and he works extremely well, or his office works extremely well with the other buildings, helping them with their budgets and maintaining security in terms of all the district funds. And I think the fact that we have, I think on annual basis, had our treasurer receive recognition from the state in terms of the audits that he has prepared, speak volumes to the detail and the supervision that he gives to our school district. I can't think of anybody I would rather have as our treasurer.
Yeah, and I'm very happy to offer this contract. I'm not going to hold any suspense. I'm planning to vote for it, Todd, okay? And I'm expecting that you're going to sign it. But it makes me very happy to do that because, when things are going well in the district and everything's going along as expected, Todd is right there, paying attention to everything, communicating it very well, and finding ways to help the district every single day. And then when crazy things happen, like, oh, we just got $2 million cut out of our budget in 2 years, he's also right there following everything, figuring out how to make it work and communicating it very well. So I, as a board member, have this sense of confidence that extraordinarily important part of our district is being managed at a very high level every day. So I'm very happy about this contract.
Todd, I would also like to say thank you for your diligent work for the school district. You go over and above all the time, as Brian was saying. And I thank you for that comfortability that I have as a board member, knowing that you dig into every situation and it always proves out to be the best move for our district. So thank you very much.
And I'll round up the group. I want to say thank you for your diligence and your creativity. You're constantly evaluating what money is coming in, what money's coming out, where do we want to go in the future, what worked well, what didn't work well. what's happening in our community that's going to affect our tax base, what's happening federally and in a state level, so there's a lot of moving parts going, and we really, really appreciate that you seem to have your eye on the ball all of the time, which is kind of amazing to me, actually. So thank you very much.
Well, I get the last word, ma'am, so. Sorry. No, my background is finance, but school finance is a whole nother game. And I want to point out how much I appreciate the partnership that you have with Diane. I think that really for our district, it comes down to you two working so well together. And, you keep an eye on the money, but you're also really interested in student achievement and making sure that whatever monies we do spend, they're being spent to give our kids as many opportunities and the best opportunities as possible, whether it's academic or social emotional or extracurricular. So I just really appreciate that. And I feel so confident and comfortable with the numbers. And I'm just always excited to see what kind of creative ideas you're going to come up with next. So really appreciate that. And then how about a roll call?
Mr. Smith,
Yes.
Ms. Powers,
Yes.
Mr. Luke,
Yes.
Ms. Savage,
Yes.
Ms. Devine.
Yes, motion carries. So you're stuck here for another 5 years.
Thank you.
Thank you. Okay, next I would accept the motion to approve our superintendent items.
So moved.
Motion by Ms. Powers,
Second.
second by Ms. Savage. Diane, do you have anything that you would like to share?
I don't think so. We just have typical HR items. We have some field experiences, supplementals, not very much in that section.
Okay. I did see we have I'm just going to do a little shout out to Bruce Motor, a bus driver who's retiring, who I actually worked with at when I worked for Dana Corporation back in the 90s, I guess it was, a long time ago. But I've known Bruce for a long time, so I want to thank him for his service. And I see Crystal Armstrong is on there, and boy, we can't thank her enough for, I just think about all the work that happened last year with delivering meals. And
Yeah, that's the only thing I was gonna add. We're certainly sorry to see her go, but wish her well. I know I had told the board previously about her resignation, but she has been a true champion for our students and making sure throughout the entire pandemic that no one went hungry, and that it was significant. So wish her very well.
yes, we do. Any other questions or comments? Okay, roll call.
Ms. Powers,
Yes.
Ms. Savage,
Yes.
Mr. Luke,
Yes.
Mr. Smith,
Yes.
Ms. Devine.
Yes, motion carries. Now we are to questions and comments. Mr. Smith, you're up here, so why don't you start us off?
All right. First of all, I want to mention that the report that we got from Tri-Academy shows that they're making fantastic progress this year. I had some things written down. I can't find it right now. I think they have 71 students and 24 of them have completed, and they have over 300 credit hours that have been earned. So just incredible work being done there. I know at Raymond, they've been really excited about some of the early results from the reading tests. They had a significant number, somewhere towards 70% of the kids pass the standard for third grade reading guarantee, and they were confident that the other kids will be able to make it. So that's always exciting. That's That's one of the first hurdles that kids run into, and it is a very significant measure of the responsibility. And I know Bunsold has, I think, a new program. I'm trying to remember. My mind is gone.
Oh, the one
on
with
that one.
Scott, the one with Scott Forney?
Yes, yes, that's
Yeah,
exactly it.
Yes. Yeah.
And so it's exciting to see new programs. I think that one's in aeronautics. It's exciting to see new programs get started in the school district because it offers new opportunities for kids to explore their interests.
Mhm. Great. All right. Ms. Powers.
I just want to thank everybody, Diane, Dr. Orsina, everybody that was involved in doing all the grafting and everything that we could see and tell what was going on in our district. I thought that was very unique, and it sure helped to put everything in perspective for us. Thanks to the teachers for continuing to do their jobs so well and to keep our children going. And thanks to Bunsold, Juliet had asked me to judge some of the doors they decorated, and I got to do that virtually. That was really fun. I got to experience some of the projects the kids did on their winter doors and stuff, so I got to vote on that. So that was fun. And just excited to look forward to a new year and to know that we're all on board with this, and for our superintendent and all of our staff to be able to go forward, but yet be on a high alert that if we need to pull back for our children, that there's always a backup plan. And again, as we were saying, how comfortable that is with Todd being our treasurer, it's also a comfort to know that we always have that plan B to fall back on.
For sure. Mr. Luke.
Well, I feel I'm really hopeful and confident about the coming year. And it's been a rough year. It's been a challenging year in the education field. And we've gotten to this point where there's some really positive things coming up right now. We got a new 5-year contract with Todd. We've got the vaccine coming in. And now we have what we've all been hoping for quite a while, which is to get the kids coming back into the building. And I think we're doing it in a responsible and a safe way. And if things get crazy again, I'm confident that we'll handle it because we've been managing what's come at us so far. And I want to thank another group. We thank all kinds of groups that help with this huge project of education, the administrators, the teachers, the parents, the support staff. But tonight I want to thank the students because the fact that this virus is not being transmitted in the building, which is key to us being confident about the tiered reentry, is due to the students. The students are doing the protocols. Talk to the teachers and principals, and the students are doing it, and that is key. So I want to thank them for that. And let's keep at it this year.
Yep, for sure. Ms. Savage.
Thank you, Brian. That was actually wonderful comment. So it has been a very difficult year. And I also want to give a shout out to some of the groups that help keep things normal. So I was noticing on all the activities that the PTOs are doing at all the different buildings. So Raymond's doing a readathon, plus they're doing a food drive. We've got Northwood doing a cookie dough sale. So I noticed that most all the buildings had some special PTO or morale building activity for the staff and the students, and really appreciate them trying to bring a little bit of normalcy back to the school experience this year.
Hey, Todd, have any comments?
Yeah, I mean, I would sincerely thank each board member for your kind comments. I appreciate that. And I'd also thank the board for your confidence in me for a 5-year contract. I definitely look forward to another 5 years, 5 years to continue the great work that we've been doing as a team. And I definitely think it's been a team effort, a team that works together seamlessly. And I hope it can be 5 more years just like the last.
Maybe let's minus the pandemic. Okay.
Right.
Okay. Diane, any comments?
When Todd said that, I was thinking, are you kidding me? The last year seems like 5 years, all in one.
You handled the hard part of that, so that's okay.
No, I think that, we will, I think, that we're committed to pushing forward, and we're going to support staff and families as we transition to this next phase. And, we'll continue to be there together and support one another as we push forward. If you have questions, don't hesitate to reach out, as you always do. But this will be a difficult transition. But even when we announced we were going to hybrid, we had angst about change, and I have no doubt that our staff will rally behind, and we'll get exactly where we need to be for kids.
Yeah.
That's what we do. I mean, that's one of the best parts of Marysville for sure.
Yep, couldn't agree more. I wanted to make a comment about the Shine FM Teacher of the Week program. I know an email went out to our parents. So for any of the parents out there watching now or later, if you've got a favorite teacher, please go and nominate them for recognition. They're going to be accepting nominations through April 30th of 2021. So please, I know probably every teacher is worthy of the nomination. So hopefully that'll happen. And I guess with some of those building notes, I just always really appreciate the amount of focus on professional development. I thought Raymond was so creative. They came up with a professional development menu with a recipe for a growth plan. So it's just kind of a creative way to frame that. Maven is doing a one school, one book again, and the author of the book is Henry Cole, and Henry Cole had actually visited that school before, so they were trying to set up a virtual visit with him. So again, kind of like what Nan was saying, I think our buildings continue to do things to try and make the school day feel as normal as possible in a very different setting. So, and kind of at Bunsel, they're talking about maybe a possible partnership with our BASE program on remote learning days to help some of those students that might need a little bit of extra support. So just appreciate our staff. We support you all. We're so grateful for everything you're doing. So with that, I would accept a motion to adjourn our meeting.
So moved.
Motion by
Second.
Mr. Hall, second by Mr. Smith. Roll call.
Ms. Powers,
Yes.
Mr. Smith,
Yes.
Mr. Luke,
Yes.
Ms. Savage,
Yes.
Ms. Devine.
Yes, motion carries, and we are adjourned at 7:34. Thanks so much, and we'll see you all on Monday.
Thank you.
Thank you all.
Bye.
Bye-bye.
Have a good night.
You too.